Hey there, it's Dr. Chris here from Accrue Health. I want you to pause right now, and if you are a pregnant mom, if you are trying to become pregnant, or maybe one of your loved ones or close friends is pregnant, this video is for you. So make sure you share this with people that are pregnant, want to become pregnant, because what we're going to talk about today is super vital for every pregnant mom to know. Now, one thing that's really critical, and I'm sure you're probably aware of this, is that the number one most common symptom that women deal with during their pregnancy is back pain, okay? The research shows that 75% of pregnant women deal with back pain during their pregnancy. And there's a lot of reasons for this. Obviously, as our pelvis and hips expand, our spinal arches change as the belly grows. There's hormonal changes that allow greater ligament laxity, and all of this occurs. And so things like sciatica, low back pain, upper back pain, a lot of just discomfort can really ensue in our daily movement or when we're trying to sleep. And so it's a very common issue that a lot of moms face. Now, what the research shows is that the most common over-the-counter that moms typically use, because they are generally told that it is generally safe for pregnancy, is Tylenol, okay? Now, there was research published in 2016 with Tylenol that showed that if a woman consumed Tylenol during her pregnancy, there was a 30% greater likelihood of emotional and hyperactive symptoms in their newborn after birth, okay? And that was 30% for each of those different things. Because what we know is that what mom is consuming, what mom's putting into her body is absolutely having an influence on the newborn, on the baby, or on the fetus in this situation. And even more so, what they found is that women who used Tylenol throughout their pregnancy on some kind of a regular basis or regimen had a 46% greater likelihood of developmental difficulty in their newborns. That is huge. And I know that for all of you watching, if you are a soon-to-be mom, if you are a mother already, if you're a grandmother and maybe you're expecting another grandchild soon, the number one thing that you care about is the health and safety of your newborn. And the reality of it is that anytime we have developmental difficulty, meaning that those milestones are not being met appropriately on time and on schedule, it tells us that something neurologically is out of balance, is under stress, is really not working and functioning properly in that newborn baby. And what we know is that Tylenol consumption throughout pregnancy absolutely has negative impacts on the newborn with this latest research. And so it's really critical, if you're a mom out there, we want to know what's safe, but we also want to know what's effective. And so it's really critical, if you're a pregnant mom out there, that you consider chiropractic care for your pregnancy. It's one of the most important times anybody could actually be under chiropractic care. And here at Accrue Health, we have extensive and advanced training in pregnancy and postpartum care, because obviously what your body's going through is different during a pregnancy and maybe in the postpartum phase than other times of your life. But it's ultimately really critical that we don't just mask and manage the pain through different types of over-the-counters or other things that can cause potential challenges to our baby, but ultimately that we are looking for the root cause of those issues. And so here at Accrue Health, through very specific spinal adjustments and corrective exercise and help and support, we can help you have the most amazing, healthy, smooth, pain-free pregnancy possible without the use of over-the-counters that definitely could pose risk to you or to your child. And so Dr. Chris here from Accrue Health. Stay tuned with us this month as we're diving into so much more pregnancy research and information for our pregnant moms out there. And stay tuned and follow updates for the end of the month, as we're going to be hosting an amazing webinar on the postpartum ABCs and how to make that postpartum transition as healthy and smooth as possible, not only physically for you and baby, but mentally and emotionally as well. Again, I'm Dr. Chris. See you guys soon. Thanks.